Well, March does bring spring, but it's also colon cancer awareness month. It's a time for healthcare providers to educate our community about colon cancer and the importance of screening, prevention, and treatment. Tyson White joins us now. And Tyson, you spoke with a local doctor about why this is important to raise awareness and get those screenings done early.
That's right, Brian. I visited Digestive Health Clinic in Nampa last week and learned that a colonoscopy is a very simple, quick procedure that could save your life. Now, according to the American Cancer Society, colon cancer cases in people 65 and older have declined over the last 10 years, which is good news. But cases in people 20 to 49 years old have increased. So all of that means these diseases are highly preventable through screenings, which is a colonoscopy. Gastroenterologist Dan McIntyre says getting screened early increases the chance of finding, treating, and surviving colon cancer.
Most of these polyps that we're finding, these are benign. They're precancerous, but if we remove them, then we're greatly reducing and hopefully preventing the risk of colon cancer down the road, in which case there's nothing else to be done. And that's the ideal scenario. But you know, in the unfortunate event that somebody is diagnosed with colon cancer, well, then we have a fantastic network of physicians and surgeons that may be involved to talk about like surgical options, or maybe in some cases there's chemotherapy.
Now, Dr. McIntyre also mentioned that some people come in for the first time have fears about colonoscopies, and oftentimes it's their first time having to go under for any procedure. He says it's simple and safe.
An individual would come in having done what's called a prep beforehand to clean out the colon. And then the colonoscopy is a very simple, safe procedure where they're given sedation, so a patient is generally completely asleep for the duration of the procedure, and then simply using a camera to look through the colon where we're trying to look for polyps, which are benign but potentially precancerous growths that we try to remove.
Now, when it comes to identifying when something could be wrong, Dr. McIntyre says symptoms to look out for are abdominal pain, unintentional weight loss, or blood in your stool. Now, talk to your primary care provider about getting a screening if you feel any of those symptoms. And again, whether you feel symptoms or not, if you're 45 years or older, or old, or have a family history of colon cancer, it's time to get that colonoscopy and get checked out. And Brian, of course, we have a link in this story at ktv.com to learn more about colon cancer screenings as well as the services offered there at Digestive Health Clinic.
As with most anything, it comes to the medical, earlier the better.
That's
so
right.
Get that done. All right, thanks, Tyson.